right, I'm going to go ahead and kick things off because I want to make sure we give as much time as possible to our amazing speaker today. So hi everyone formally. Thank you for joining. I am Nicole. I'm Good Dogs Community Lead for those of you who don't know me. And I just want to thank everyone for joining us today for another Good Breeder webinar. Today we have a really great presentation for all of you. It's going to be about a smooth whelping, prepare for disaster, and all will be well. I think that's one of my favorite taglines we've had to date, as someone who always likes to prepare for the worst. And we brought back our amazing guest, Dr. Julie Cecere, who's going to be covering the topics of pregnancy management in preparation for a successful natural whelping, as well as normal and abnormal whelping scenarios so that you truly feel prepared for everything as breeders. We're going to be paying particular attention to the things that we as breeders and veterinarians can control before and during whelping and how to recognize when things are not going quite as planned. And we're also going to be discussing the general treatment recommendations and outcomes on member of our Good Breeder community today. So we're so excited to get things started. Just a quick few reminders before we pass things over to Dr. Cecere. As always, we got a lot of pre-submitted questions before this presentation, so we're going to prioritize those, but please feel free to use the chat throughout the entire presentation to share comments, ask questions, and we'll do our best to answer those live ones that come in as well. And I just want to share a little more about Good Dog for anyone new here who's joining. I see some names I don't recognize, which is always exciting because I get to tell everybody about who we are. So Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders like yourselves, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community that's created just for dog breeders, and we use the power of technology to help breeders run all aspects of their breeding programs from start to finish with tools like our best-in-class software to post your available litters, connect with Good Dog applicants from across the country, use our secure payment system to take puppy payments securely and not worry about scams, and ultimately just find really great homes for your puppies. And we also offer a number of free breeder educational resources, webinars just like this, a number of articles, past webinars. We have an entire library on our Good Breeder Center, which I invite everyone to check out. We also have a number of exclusive health discounts for members of our community. So if all of that sounds good to you, or even just some of it, I really encourage you to apply to join and just learn more about Good Dog and how we support dog breeders by visiting the link that we'll drop in the chat in just a minute. And then before I pass things over to Dr. Cecere, I want to just share a little bit more about her. We're so excited to welcome her back. We've been lucky enough to have her on a few months ago for a previous webinar. So I just wanted to remind everybody of who she is and her amazing background in canine health. Julie Cecere completed her veterinary education at the Virginia Maryland College of Veterinary Medicine. She worked in private veterinary practice and commercial settings before returning for residency in animal reproduction. Dr. Cecere is a diplomat of the American College of Theriogenology, an organization to which she has contributed in several leadership and service roles. She is clinical associate professor of theriogenology at the Virginia Maryland College of Veterinary Medicine, where she has developed an internationally recognized clinical service for canine reproduction. So really no one better to have here today than her. Dr. Cecere lives in Virginia with her family on a small hobby farm and enjoys upland dog hunting with her children and riding horses in her spare time. So with all of that, Dr. Cecere, I'll pass this over to you to get our presentation started.
Thanks, Nicole. I think we all have a little bit of Olympic fever. We're a big sports family. And so we find ourselves doing the exact same thing. Like by the time we look at our watches in the evening, it's like 11:30 and our kids are still glued to the TV, whatever sport's being shown. So yes, I can totally relate to that. Hopefully today, this topic is something that we talk about a lot in the clinic. We also talk about a lot with our veterinary students. I think one of the biggest things as far as reproduction and small animals goes is what do we do when things go wrong during a whelping, or how do we recognize so that we can be more proactive about things? And so this is a topic that's very near and dear to my heart for sure. And so hopefully we'll be able to kind of like walk through some things with everybody today, and kind of debunk the couple of myths, kind of have everybody a little bit better prepared, and just realize that, again, if we prepare for the worst and hope for the best, that that preparation actually is probably 80 to 95% of the success of having things go correctly. And then sometimes things just go wrong. And if you're prepared for those, that's okay. And so, you know, we kind of need a roadmap of where we're going. I know this is not a very fancy slide, but we need to prepare well in advance. I'm going to talk about that. I think work doesn't start after you've bred the dog. The work starts well before you've bred the dog. And so we need to talk about that. And in that, we're going to talk about diet, exercise, specific milestones that need to happen, and that people need to be paying attention to well before we even talk about the whelping event itself. And so after we talk about those, we'll talk about normal stages of whelping, what's normal, what's not normal, how can we recognize these before we actually get into a problem, and let nature take its course. Kind of one of those things where sometimes sitting on your hands and just letting it play out rather than interfering. Sometimes us interfering is worse than actually just kind of waiting for a little bit. And then again, as a part of the whelping process, we've got to talk a little bit about the babies that are born, and things that we need to do to them during that process. So this is a slide that you guys have seen before. If you've seen my other Good Dog Talks, pre-breeding examinations are really, really important. And since the bitch is the one who's responsible for doing the whelping, we really need to make sure that she's healthy and that she is able to withstand the rigors of pregnancy and parturition as well as lactation. So making sure that she's up to date on her normal core vaccines, tick-borne and heartworm status if we're in an area that is important. Genetic testing, you guys are breeders. I know everybody knows about that, but it is very, very important to make sure that we maintain genetic diversity, but we also are keeping an eye on anything that might be heritable, and trying not to propagate those types. Diet plays a huge role, especially in the time frame during pregnancy and lactation. But something that if you take a uterus that may expand to the size of 2 basketballs within an abdomen, your stomach can't expand and be able to very easily take in a bunch of nutrients. And so diet is something that we're going to spend some time talking about, and in that making sure that we are providing adequate calories in preparation for the whelping event, because sometimes when that abdomen gets so distended by puppies, it's really hard to get food into them. But we have to, because they need to have energy to do, it's not called labor for nothing. You have to work. And so again, if you're trying to work on an empty stomach, it's not going to go very well. Again, flea and tick, just talking about those potentials for parasites, and cytologies and coulters. This is something that I'll probably cover more in my talk that's going to be in the future. But again, there are some things that we need to worry about, but most of the time, whether or not the culture is done appropriately, and if it is indicative of something that's going on in the uterus, or if it's just a normal vaginal flora, those are 2 very different things. And how do we interpret those? And so again, working with a reproductive specialist, not just putting everything on antibiotics, because if that is the case, then we may end up with a multi-drug resistant bug and we've got nothing to treat it with, and you certainly aren't going to get pregnancies then. And then plan. I cannot stress this enough. You need to plan A, B, C for your breeding. You need to plan A, B, C for your whelping. These plans should be well in place before the female even comes into season. And the reason that we say that is because things can change in an instant. And for some reason, you know, you were going to go to this one clinic, if you were going to end up in trouble with whelping, and they have a family emergency and the clinic's now shut down. So where do you go after that? So the more planning you do in advance and have contingency plans, the better off you're going to be, and relaying these to your veterinary staff so that, again, everybody's on the same page and knows what's expected of them. Now, one thing that we don't spend a lot of time talking about, at least with our breeding clients, on the outset, is something that we probably should spend more time on. In our normal physical examination, typically we are going to do just a great physical exam on the dog. Hopefully we've seen them for any of their genetic or phenotypic testing that's required for their breed. But as a part of that examination, we're also going to do what's called a digital vaginal exam. And the reason that this is important, I have 2 wonderful pictures up here. So I'm going to tell you that these are taken through a camera that was passed up into the vagina of these 2 2 bitches. The dog on the left, to orient you, the hole that is at the very bottom, it kind of looks like the scary face where the mouth would be, is the opening to where the urethra is. And then the 2 holes that you see on the top, that's the opening into her vagina, where we're going to go up and see where her cervix is and where the puppies are going to come through. And if you see that that's actually split in 2. She's small, she's split in 2 there. That was palpated on examination during a pre-breeding examination, and we were like, whoa, we need to go see what this is. That would have precluded a natural breeding. It also would preclude a natural whelping, and that's something that you need to know about sooner rather than later. So again, that's really, really important. Another extreme of that is on the left hand or the right hand side. What you have is a catheter. You can kind of see it in a gray color passing on one side of this fold that is dividing the vagina into 2. And again, this was something that was not caught on a digital vaginal exam because my finger can only go so far. But when we went to go breed the dog via TCI with a scope, we actually saw what's this dorsal ventral band. And so again, this is a conversation that we have to have, because in a natural whelping or a natural breeding, we might get lucky and have the babies passing on one side or the other and not getting hung. But 9 times out of 10, depending on how big that band is, you might get a baby stuck on one side or the other. Say the head decides to go to the right, but the arm decides to go to the left. And so knowing about these things is very important. Are they super common? They're common enough that I teach my students about it. So again, making sure that you guys are well aware, and if they have any familial history of these types of bands or strictures or anything like that, that we know about those things, so that we can take an extra look, because there's nothing worse than finding out that we have an anatomic abnormality that leads to a dystocia. Because if we had known about it beforehand, we might have discussed potential options to steer clear of that problem before it was even an issue to begin with. So we've talked about breeding in the past. I'm not going to go through that. The biggest thing is returning to a normal routine until pregnancy diagnosis. And we're going to talk about what that normal routine should look like. But I just want to note here that there should be mild changes in biosecurity concerns. You've just bred them. The last thing that you want to do is take them to a dog show and end up coming down with kennel cough or canine influenza virus, because again, that's only going to put more strain on your dam. So again, mild changes in biosecurity concerns. Certainly, I would not necessarily be taking them to bench shows or taking them to doggy daycare or boarding them at a boarding facility. But certainly, it's not until pregnancy diagnosis that we really kind of lock down that biosecurity. And then pregnancy milestones. It doesn't matter how you bred your dog, what kind of dogs you have, or what you're doing. All of these things are kind of important to talk about. And so typically that pregnancy check, because you need to know, is she open, is she not open, is going to be around 28 days post-ovulation. So about halfway through, I can tell you, yes, no, she is pregnant. I can give you a general idea of how many babies are in there. Take that with a grain of salt. Ultrasound is only 30% accurate at counting the number of babies that are there. So don't think that that's your count. But I can also tell you if we have viable puppies and or if I have fetal demise or resorption sites. 1 or 2 resorption sites in a full litter. Otherwise, that's considered normal. If I only have 2 puppies and there's 3 resorption sites, then that makes me as a reproductive veterinarian go, something's going on here. And so again, these milestones are really, really important. And again, preparing you guys for the most successful whelping outcome that you have. If you do an ultrasound at 28 days and they say you have 14 puppies and you don't do any other things after that, and you're sitting around waiting for her to whelp and waiting for her to whelp and waiting for her to whelp, dogs can resorb puppies in that second half of pregnancy, and they can resorb an entire litter, or you can end up with a singleton. And so again, making sure that we're checking down through these lists. Deworming is important, because even with the monthly dewormers that we have, there's been no scientific research to say that there's no recrudescence of our intestinal parasites during pregnancy, or that those are effective. And so we just do an extra bendamustine deworming day 41, 42, and 43 of gestation, again, just to reduce the worm burden on puppies when they're born. And if you're planning on free whelping, C-section doesn't bother me as much, but if you're planning on free whelping, you're going to let them try to do this naturally. Pre-whelping radiograph is really important, and that helps us in making decisions at the veterinary clinic of how we're going to handle a potential dystocia. There's a big difference between I have delivered 8 puppies, I have 1 left based on radiograph, I've got 9 in there. Does the owner really want to go to C-section on 1, or are we just going to see, even risking that baby's life, are we just going to see if she's going to pass it on her own, versus I've only produced 2 and I've got 10 more in there. Those are 2 very different scenarios, and we're going to handle them very differently because we know how many puppies were there based on radiograph. So really, really important. And again, due dates, 63 days from ovulation. That's with good ovulation timing. That's not based on cytology. That's not based on breeding dates. Those are very important. If you're trying to do planned C-sections off of what I called soft timing, you're going to potentially end up in disaster with premature puppies. It's not worth it. So ovulation timing all the way, unless you're willing to sit around and just wait until she decides to go ahead and go into labor. Okay. Now, this one is also not a very, what I would call a sexy slide, but there's a lot of information on here that we're going to talk about. I think no one is going to argue that pregnancy is not a metabolically demanding part of life. It is extremely metabolically demanding. And why it doesn't look like it is outwardly, the studies that have been shown and the reasons that we don't recommend back-to-back-to-back breedings is because the body cannot respond and recover from 2 pregnancies in a row without having some loss in fertility. They just can't support that. So we really need to make sure that we maximize what we've got. Certainly, there are multiple species implicated for subfertility or infertility related to obese or sedentary lifestyles. We know that in equine, bovine, human, mice. We are doing a study right now at Virginia Tech looking at that for canine. We have not scientifically proven it, but clinically our impression is those animals that are obese and or have a sedentary lifestyle are going to have a lot more trouble getting pregnant, having full litters, and whelping. This is a big one. And so rather than just kind of, saying this, I wanted to kind of highlight a couple of studies that have been done in horses. Now, a couple of things that we need to note. Dogs aren't horses and horses aren't dogs, but because horses are easier to study, these are what we have to go on. And so in this one study, they took mares and they wanted to look at the effect of exercise on their ability to get pregnant and their ability to produce quality babies. And that being said, they had 2 basically groups. They had mares that were used to moderate exercise prior to pregnancy. They were on some sort of exercise regimen. We're not talking Olympic caliber horses or race horses here. We're just talking about ones that are getting worked on a semi-regular basis, what they called moderate exercise. So, I would think probably like a trail riding type animal, not something that's going to be doing high volume, high impact type of exercise, versus mares that were doing nothing. And then they were bred and exposed to exercise during pregnancy. And those are 2 very different cohorts. And what they found is that the ones that are used to exercise prior to the pregnancy actually fared better and their babies did better than the mares that were all of a sudden decided to be exercised after they were bred. And so that's something we're going to talk about a little bit more. They also took it one step further because in the equine industry, a lot of these animals don't prove their worth until they're much older. And so they're actually trying to obtain embryos and oocytes from these mares while they're on a very, very rigorous exercise and show schedule. And what they found is that the embryo recovery rate, so the number of embryos they got, weren't different between control mares who weren't doing anything versus moderate exercise, and then heavily exercised animals. And so again, there really wasn't a difference between their exercise group on what they got as far as embryos. But what they did find was the embryo quality was different. And so like the heavily exercised mares actually had better embryos, and control mares had better embryos, but the moderately exercised ones did not. Again, in this study, they were just exposing them to exercise during that periovulatory period, not before. So again, probably a big difference between all of a sudden now we decide that, oh, we're getting a little overweight, we're going to just slam them with exercise because we bred them or we're about to breed them, versus somebody who's been doing moderate exercise for a longer period of time. There's been lots of studies in canine looking at insulin resistance, increased triglycerides during pregnancy. All of these things happen just as a normal status during pregnancy, and that's going to have an effect on your ability to actually do the process of whelping. And so, again, talking about mares, they didn't find a difference in obese mares versus good body condition mares in their actual whelping, but mares only have one, and it's a very explosive whelping. The average time frame of, or excuse me, it's a very explosive foaling. The average time of a foaling is 30 to 40 minutes from stage 2 to the time that that baby's supposed to be out. It's an extremely explosive event that requires lots of abdominal help and uterine help, but they only have one baby to get out. So they can muster up and be able to push that out. But what about our litter-bearing species? And that's where we kind of get to dogs. And so diet and exercise are going to be really, really important. One thing that we have a lot of control over is how much are they eating. So we can feed them to obesity without even doing anything. So making sure that we're staying in that lean body condition. I really prefer my dogs to come in at a 4 or a 5 out of 9 body condition score. We have an abdominal tuck, we have a waist, and we're coming in lean and mean. And so here's an example of a Weimaraner that is pre-breeding, and she is several days out from whelping a very large litter. I think it was 8 or more puppies at this bottom picture here, but you can see the body type of the dog. She's still maintained that I still can see where her ribs are. I can see where the end of her ribs end, and she still has muscle definition along her top line. What ends up happening is a lot of people don't realize in the last parts of pregnancy, those babies require so much energy that they actually can't eat enough because of the expansion of the uterus, and or they're not being fed enough, that the body starts using its muscle. And so they look big because they're all abdomen and puppy, but they have actually eaten a lot of the muscle that they have along their top line. So making sure that they stay in that good muscle condition score all the way through pregnancy is going to be really, really important. And there's a big difference between what I see clinically in performance animals. So this is a bird dog. She's obviously out doing her job, and she's running. Some of these dogs I know will go 5-10 miles running, 15 to 20 miles an hour, self exercising next to a four-wheeler or a horse while they're pregnant, and they're grossly pregnant. Don't push them, but let them be dogs and let them run around and do their thing, versus my kind of couch potato. And sorry for putting a golden up here because I know not all goldens are couch potatoes, but I tend to have more problems in my dogs that are more used to having not great exercise habits. And so there's a huge difference between having a large litter like this dog had and not getting a lot of really great exercise on a regular basis throughout her pregnancy and or before her pregnancy, versus the one that we saw before that is doing a lot of hardcore exercise that tend to have not as much time. And then again, we've got these guys that are just, race horses in dog clothing, very, very different. And so really the thought process that needs to happen is we need to remember that dogs don't just have a singular baby. They are meant to carry litters. And so when they're prepping for that whelping process, we need to say, okay, we know that they're going to have to work for labor. We need to make sure that a level of nutrition and a level of exercise endurance, they're used to working, that they're going to be able to sit through hard labor for 3 to 5 hours and be pushing puppies out on a regular basis. They should really be having puppies every 30 to 40 minutes. Boom, 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 boom. They can take a little bit of a break in between because, again, that's a lot of work, but we really shouldn't be having 6-hour waits in between puppies. And we'll talk about that a little bit more. So just kind of put that bug in the back of your mind while we talk about kind of what the normal is. So all labors happen in stages. Small animals are no different. And so dogs, we talk about stage 1 labor. And this is kind of where all of the cortisol is happening, or our CL that's maintaining pregnancy is getting lysed. Uterine oxytocin is receptors are being upregulated. We're starting to get irritability in that uterus, but we really aren't in stage 2 where we actually start getting pushing and delivery of fetuses. This tends to happen at any time of the day. Final position and posture are achieved. And this was a question that was in the questions. In our small animals and in our bitches, we can have babies that are born in anterior, which means their head first, and posterior, which means their tail first, and that's considered normal. And the statistic is about 30% of your litters are actually going to be posterior. True breech means that the spine is going to be up against the cervix and they cannot get the baby past the cervix. So true breech is actually going to be an obstructive dystocia. What we're seeing is when they come tail first, that's completely normal, and it's considered a posterior delivery. Typically, stage 1 is going to be anywhere from 16 to 18 hours. It varies from female to female on whether you actually recognize it. We have some girls that we don't recognize it. We know it's happening, but we don't recognize it. Some girls they do the lay-in, they stop wanting to eat, they might get clingy. It's just some days when you are putting down the food and all of a sudden they look at you and they're kind of like, yeah, I don't want to eat that. Or they're just kind of, something has changed. We know something's going on and we're around our due date. Stage 2 is active pushing with delivery of the fetus. You should see active contractions. You should see active abdominal pushing. And again, that anterior or posterior presentation is completely normal, and not something to be of concern if you see something come tail first. Now, statistics have shown, or depending on what you read, 6 to 12 hours on average. With that being said, me as a reproductive specialist, you really shouldn't have a whelping that's lasting more than 6 or 8 hours, even with an extremely large litter. Again, 30 to 40 minutes between puppies is considered normal. And how many puppies would we have to have if we were at 12 hours? So again, that needs to be taken with a grain of salt. That's what's stated in the literature. But if we actually look back at successful whelpings, and ones where we don't end up with a lot of stillborns or a lot of issues, we're not taking more than that kind of 6 to 8 hour mark because we're pushing out puppies on a regular basis. And then stage 3 is considered passage of that placenta. With that being said, retained placentas are extremely rare in our bitches and typically don't cause any problems because of the way that the uterus has to involute post whelping. And so again, note if you don't see a placenta, or you may end up getting a puppy and then 2 placentas. It just depends on if they got detached from that placenta or not. Or sometimes mom eats it before you even have a chance to look at it. So again, something to talk about: stage 1, stage 2, stage 3. And what I did with another diplomate friend of mine a couple of years ago, we developed this chart and we use this with our clients at all times to say, hey, this is just kind of the things that you need to look for. And so stage 1, again, anorexia, nesting, panting, but absolutely no pushing. And this can vary from female to female, can last up to 18 hours. Certainly, if we're on our due date and we've been doing this, I may have you come into the clinic just to check fetal heart rates, make sure everything's okay if we're at a 12-hour mark. But that being said, it can last a little while. Now, when you should call your veterinarian: if you caught a temperature drop and you're positive it wasn't a temperature of her poop in her colon, like you took it several times, you knew you were up against the wall of the rectum and not in the central portion of poop, and she's not had labor signs in 24 hours, you absolutely should be calling just to have a fetus check and make sure. If you didn't do a pre-whelping radiograph and you never confirmed pregnancy, again, this is a situation where we probably should just make sure, because we've had animals that have either resorbed their litters or actually never were pregnant and they were waiting around for puppies to come and there were never any puppies. And they're like, well, she got big. Well, they were also being fed for pregnancy and so they got fat. So that being said, and then again, 18 hours is kind of my upper limit. If I haven't seen you before 18 hours and nothing has happened, I want you to bring them in to me. Stage 2 is active labor. So you should see contractions, you should see pushing. It can take up to an hour of pushing for that very first puppy to come out. And what that is that first cervical dilation takes a little bit more work than subsequent dilations. But really after that, we shouldn't see any more than 30 minutes of pushing to deliver subsequent puppies. And so if we reach that 1 hour point for the first puppy, then certainly that should be a red flag that either she's struggling or something's wrong. That would warrant at least a phone call. And again, if she starts pushing for subsequent puppies and she's been pushing for 30 minutes, it doesn't seem to be making any progress. That's another red sign or red flag for you to be calling. Like I said, if you have a large litter, sometimes it's okay. They will take a nap in between. It's labor. They have to rest when they can. But if they're resting for greater than 2 hours, I want a phone call. I'm going to be telling people, okay, it's time to get them up. Let's trot them around. Let's move them around. And sometimes that will swing them right back into the whelping process. Otherwise, the biggest thing, and we'll talk about this number 4 here in stage 2, significant and increased time between each puppy. That's an indicator that she's getting tired. And we need to pay attention to that, especially if you have a large litter expected. And then stage 3, passage of the placenta. Again, this usually is not an issue until multiple days after whelping. And so again, if we have foul smelling, purulent discharge after whelping, then that's a reason for you to be calling the veterinarian. Now, we have this bottom one here that says, anytime you see this, absolutely give us a call. Black vulvar discharge. So uterovertin, which is bright green. If you actually take a white paper towel and you wipe it, it comes out bright green. I have a picture of it. It's different than black. Black is necrotic and usually means something is dead. So that is never normal. We need to know about that. We'll probably say, jump in the car, come on. Most of y'all probably have whelped litters before. What I try to tell people is the birthing process is a fluid-filled event, but it should not be lots of frank hemorrhage. We should not see a lot of fresh blood. We may see some, but we shouldn't see a lot. So anytime you see a moderate to a large amount of fresh hemorrhage, again, that should be a phone call because there are some things that can happen, or it may be an indication that we've got a problem and she hasn't shown outward signs other than the discharge out of her vulva. And then again, we try to tell our owners, I would rather you call me at 2 o'clock in the morning and it be nothing than you wait until 8 a.m. to call me during normal business hours. And then all of a sudden we really have a disaster on our hands. So this goes back to the preparation thing. Make sure that you have a plan, somebody that's going to help you out, and where you're supposed to go. And again, we kind of developed this chart just to help our breeders out on when to recognize when there might be a problem. So again, what and who? So dystocia in itself is just difficult birth, right? And so if you look at the literature, around 10%, the range being 2 to 23% of all whelpings end up in dystocia. And there are some predispositions that are definitely going to make us have pause and go, okay, this one's at a higher risk for having a dystocia. And these are things that have been scientifically proven. So litters with less than 3 to 5 puppies or greater than 11 puppies, both of those. So if you're in the 6 to 10 range, you're probably okay. But if you're less than that, 5 range, depending on the size of the dog breed that you have, or you're greater than 11 puppies, those 2 things can be problematic. Any bitch that's over the 6 years of age typically is at a higher risk for having dystocia. Again, we talk about the metabolic demand, and being a 6-year-old animal, if you're healthy otherwise, we need to make sure that we're paying attention to diet and exercise and that she's in a good plane of nutrition before we actually breed her. Smaller bitches and smaller breeds, again, that's always an issue. The smaller we make things, the worse we are going to have chances of having a dystocia. And a lot of that is because of a maternal fetal mismatch of size of body parts. And so again, as we change the phenotype of certain breeds, we're actually breeding for problems, if that makes sense. There's a reason that brachiocephalic breeds have no natural whelping. We made that. They would not exist if we did not make that. So again, brachiocephalics are automatically on that list. And then singletons. Small breed and toy breed dogs don't always have a problem with singleton pregnancies, but medium to large breed dogs typically are going to have a problem with singleton pregnancies. And a lot of that is related to how big that baby gets, number one, and number two, whether or not there's enough signal to throw them into labor. Because they think about it, if they have that entire uterus or one entire horn to themselves, then they can hang out and have no problem. So again, very important. So one of the things that we really, really push very hard on our owners, and this is something that's going to go back to that, increased time in between puppies. Record keeping is really, really important. And so we use this chart. We adapted this from a good client of ours on you need to keep records on what's happening during your whelping. Who was born, what time were they born, and then you can do your color markings, all that kind of stuff if you want to. And we've actually adapted a human APGAR score to our puppies. And we use that just to see specifically after C-section to see if there are any babies that we're worried about. They actually have an adapted APGAR score for brachycephalic, like bulldog puppies, because they don't breathe as well as everybody else does. But that being said, the biggest point that I want to see is that time between puppies, because again, positive predictive values have been looked at. If we go from an hour to 2 hours, the predictability of having a stillbirth, so a puppy that is born dead and that we are not going to be able to recover, goes from 13% to 28%. By the time you hit to 4 hours, 36% of the time, you're probably going to end up with a stillborn. So the longer we wait in between those puppies, the more chance we have at a stillborn being born. And that is not our goal, right? We want everybody out happy and healthy. So again, reiterating kind of what's in there. 4 hours of weak contractions and no puppies. I certainly want to see you, and we should be having a conversation about that probably well before, but that's something that we need to talk about. If we taken a break and we're greater than 2 hours, it's time to get up. It's time to move around. Let's try to offer them some food and some water, some Kira syrup and water, any glucose source that you can get into them. And or we have 30 minutes of active bearing down and pushing and we're not producing a puppy. Those are all concerning time points, and I want a phone call, or you should be calling your veterinarian. Black or excessive vulvar discharge and no produced puppy, that again, that is something that we need to talk about, and or frank hemorrhage. And so something that we talk about here is that uterovertin that's on the bottom right there. It's that bright green color. You can see it really well on white, but if you have it on a dark blanket, it's going to look like it's black. So make sure that you distinguish between the green color and black color, because this uterovertin comes when a placenta has been separated. You've got a baby that doesn't have an oxygen supply. Once we see uterovertin green, we should be seeing a puppy in 30 to 40 minutes. If you do not, that's an emergency. You need to call somebody and hopefully call them on the way. Now that we've kind of identified a few things, we need to talk about the management, and that's going to be medical and surgical. And I'm going to walk through a couple of things, but in doing so, I've got a couple of videos that I want you guys to watch. So the first one is going to be a normal parturition. So this is that same dog who's a bird dog, and thanks to the breeder who gave this to me because I use it all the time. This is a dog who is doing her job. So there's the push. And I want you to pay attention to her perineal area. You can see where her tail is. That's push number 2. And you will actually see that baby move down. There's push number 3. And here comes baby. See that amniotic sac just moved down. 4. And she's like, okay, it's not out far enough yet. Just gonna give one more giant push. 5. And baby's delivered, okay? So that is normal. This is how hard they should be working. It should only take a few hard pushes and be able to move those babies down. And so that's really important. If we don't know what normal is, then we can't recognize abnormal. Now, I'm going to show you 2 different examples of breeders that have used these charts, okay? This was a litter of Aussies that were born, and I want you to look at the time frames in between this, okay? 727. 739, 813, 824, 844, 856, 859. We took a little bit of a break. 936, 1047, and then 1145. So you can see she was doing really well there for a while. And then kind of towards the end, we got a little tired. I would expect that. She had 10 puppies, okay? But she had 10 puppies between the hours of 7 and midnight. So how many hours is that? So 4 to 5 hours. This is a rock star. She did a really, really good job. Okay. And this is where this is really important, because if I'm asking, you're calling me to say, oh, we have a trouble, I'm going to go, when was the last one born? How many are out? And give me the time frames between each so that I can kind of determine what's going on. Versus this was an animal that actually whelped in our clinic that was in for pregnancy toxemia. We knew that she was going to have trouble because she was in such a negative energy balance. But we had chosen not to take her to C-section because of how metabolically unbalanced she was. And mom at that point was way more important than the puppy. So look, she had her first puppy at 9:30. Great. Had a second puppy at 10 o'clock. Okay, we're looking at 37 minutes. That's not too bad. But then we wait until 2:25 to have the third one. And it was actually born alive, which I was very, very surprised. But again, we had made the choice that we were not going to intervene surgically because of this dog's metabolic demand. And then again, we had another one at 5 p.m. Shockingly was alive. This was a small breed female, but you guys can see the difference between the two examples that I gave you. This was only 4 puppies and it still took her all day long. This is not a normal whelping. Okay. This is where this is really important. Okay. Now I always get the phone calls of what supplies should I have on hand in preparation for whelping? Really, it's not extensive. Okay. Some bulbs or syringes that if you feel like you need to suction nearings in the mouth, gloves, a hemostat and or unflavored floss if you have an umbilicus that is bleeding and or got chewed just a little bit short. Have those on hand. A scale for weighing, lube in case you need to have a feel to see what she's doing. And we do collars so that we know who is who. You guys, if you are fortunate to have breeds that have multiple different colors, you might be able to tell the difference between their color or their markings. But in the hospital, we go ahead and slap collars on them because we know. But really beyond this, you shouldn't need anything else. We're not giving oxytocin to go home. I'm not going to give calcium to go home. In the instance that we're going to need those things, I want it in a controlled environment so that I can adjust real time so that we have the best positive outcome. Okay, so I'm going to go through a couple of cases here because I feel like this is something that we need to, you have to see things to be able to recognize when they're problems. And so this was a 5-year-old. This was her very first time frame of being pregnant. She'd never actually whelped a litter before, and she was presented for dystocia. And so certainly questions that we were asking. Did she produce anything? She hadn't produced anything by the time she came to our clinic. How long has she been in labor? She'd been in labor for 3 to 4 hours at that point, active labor, what they thought was active labor. In physical exam, she was bright, alert, happy-go-lucky, obviously in labor, but kind of like not really doing her job. She was more interested in the people around her than she was about doing her job. And so we kind of set her up in a darkish room just to see what she was going to do. And so again, here's another video. I want you to think about what we just saw with the Weimaraner, and I want you to watch this dog. And there's one puppy that was produced, and then I want you to watch her perineal area here, but also pay attention to her panting. And that's going to be very apparent. So you can kind of see her breathing a little bit, but she actually has an amniotic sac right here. Okay, but watch her chest. And so she's kind of panting and breathing, and then she stops. That was her push. She wasn't working hard at all. And at one point, you can actually see this baby moving in the amniotic sac going, hey, hey, I'm down here. Somebody help me out. So again, there's a decent push. She decided to actually get down to work, but still not extremely productive. And so again, these types of observations are something that is really important when you're talking to us, because she may have a weak Ferguson's reflex if we were actually to palpate her, but this dog without some extreme support is not going to be able to deliver the remainder of her litter without risking the rest of the litter. And so you guys know we actually ended up delivering the rest of the litter surgically. You don't see us jumping in there. That baby's doing just fine. Again, the power of observation, let nature take its course. That baby was not going to suffocate while it was sitting in there for a couple of minutes. It wasn't that big of a deal. So again, sometimes contractions can show up as a pause and panting or a looking back at their side. It's not always as obvious as we would like it to be. And so being aware of those is going to be really helpful. And so now we have another dog, again, 2 years old. This was her first litter. She was presented for dystocia. The owner was just like, oh, she's not producing anything. She's not doing anything. I would say that sometimes being very good owners are extremely distracting to dogs. And there's a reason that dogs kind of leave and want to go in a dark place. There are some that want to be clingy, but most of the time when they want to get down into that really truly labor trance, they need to be away from everybody else. They don't need to be in the living room. And so again, what we found out was the owner was distracting this female. And so once we actually separated her, she delivered 2 puppies and was working on her third with very, very productive contractions very easily. And so again, it's one of those things where sometimes it's best if with the advent of cameras, if it's a dog that doesn't want you sitting right next to them, if they want you sitting right next to, obviously you can see we were in the room with her, but we weren't talking to her, we weren't fussing with her, we weren't petting with her, we were literally just sitting there in case something went wrong. That is very, very helpful. And so again, this dog that presented for dystocia wasn't in dystocia at all. She just wanted to be left alone. Now, most whelpings go well. The biggest thing is when to determine that we are pushing hard enough and we are not getting anywhere. How do we determine if we've got a potential obstructive dystocia going on? Because those are the ones that are really worrisome. I've got 2 videos of obstructive dystocias here. A lot of these girls will figure out whelping, they'll use gravity. And so they'll actually squat to pee or poop. And if they're not actually peeing or pooping. And so this dog here was squatting and actually produced feces, but see how she doesn't get up right afterwards and move off? She's actually pushing extremely hard and nothing is happening. Again, in a clean environment with gloves, you can use some lube, pass your head very gently up there and see if you feel anything. But most of the time with these girls, if somebody says that they've been having this type of behavior that this dog was doing, where they're just squatting and going to the bathroom, I'm going to say they need to come in. This little dog had been whelping for quite a while and was in active labor. She ended up having a singleton and it was a fetal maternal mismatch. It was an obstructive dystocia, but she's actually vocalizing every single time she pushed. The baby was alive and we did get it out alive, but these are the types where they're working really hard and you're not seeing any progress, no fluid, no amniotic sac, you can't feel anything. These are the ones that are really, really, really important to recognize and get to a clinic very quickly. Okay. All right. So now we're going to say we've identified that we have a dystocia. What's going to determine whether or not we can medically manage this case or it's going to end up being a surgical case? And that's going to be the Ferguson's reflex. And so that was one of the questions that asked, how can you tell? Ferguson's is a reflex that happens when there's pressure up against the cervix and or through the birth canal. So something is pushing up against that cervix on its way out or has been through the cervix and is on its way out and in the birth canal. It's going to produce a reflex from that female to want to bear down and push. We can stimulate a Ferguson's reflex once they're in active stage 2 labor by introducing our hand up there and increasing the pressure within the vaginal vault. If we have a dog that presents to us in dystocia and there's no baby in the vaginal vault and we do not have a dog that tries to bear down and push on us, that's a negative prognostic indicator for medical management. They still have to work to get that baby out. They don't just fall out of that uterus. And so again, if they don't have a Ferguson's, it's a whole completely different ball game because we're not going to be able to give them any drugs because we still have to have mom be an active participant to be able to get them to push out. If they have a weak Ferguson's, then I might be able to make that a little bit better. Now, on this list, I've got oxytocin, I've got calcium, and I've got glucose. People are like, why do you have glucose up there? Well, a lot of these dogs go anorexic for a few days before whelping. And so that's really, really important because if I can get them to eat milk replacer, ice cream, yogurt, I don't care. I'm not doing it for the calcium. I'm doing it for the calories. I want them to actually have some glucose during whelping. That's why I let them eat their placentas. It's a source of energy. Oxytocin, when I give it as a shot, takes what is normally a cranial to caudal, so from the tips of the horns down to the cervix, it's a wave-like fashion naturally. When I give oxytocin, it's like taking a baseball bat and whacking your uterus with it. It's just one big fat contraction, which may be what you need if you have a large puppy that just needs a little extra oomph coming out. That's fine. But if I give it once and I don't get much of a response, I'm not going to give it again, because all you're going to do is cramp the uterus for a very long time. Because why oxytocin is said to work in 15 minutes and be gone by 20, there's actually small amplitude waves that happen for 12 hours after a single oxytocin injection. So oxytocin is not benign. This is why we don't send it home. You can certainly cause a lot of damage with oxytocin. Calcium. So a lot of people will say, oh, my bitch is hypocalcemic. We very rarely see hypocalcemia. It's actually only less than 1% of dystocia cases throughout several studies where they were actually hypocalcemic. That being said, calcium is required for muscle contraction. And so we can give them a little bit of a boost, but again, it's not something that I need to be giving calcium in a tube format or Tums after every single puppy being produced. I can produce the same result with just giving them food, because they're probably not hypocalcemic. They're probably hypoglycemic. So two different things. And then the statistic is that you need to realize 80 to 90% of medical treatment fails. And what does that mean? We end up with a dead puppy, or we end up in surgical management. So again, trying to make these decisions, we can potentially say, all right, we'll correct some hydration. We might give you some glucose. We might give you a little bit of a calcium source and one shot of oxytocin. If they don't respond in that first 30 minutes of us doing all of those things, then at that point, we need to make a decision on what we're going to do. Other thing is palpation, what's there. Don't ever pull on a single limb. Don't ever pull on a tail. You may end up with that single body part in your fingers. So again, just being very careful. If you're ever going to use lubrication, you need to use clean, sterile lubrication with clean water and mix it at a 1-to-1 ratio and put it through a red rubber catheter. And then in our hands, sometimes the surgery is not an option, and we have one baby sedation and or an epidural to assist us in getting that fetus out. It's going to be important. But the biggest thing is making sure that everybody is on the same page where we are financially, where we are, and is the dam more important than the baby, or the baby's more important? Do I have one baby? Do I have multiple babies? It's kind of there's no Venn diagram that's going to be able to give us every single scenario, but we need to all be on the same page, because if surgery is an option, then we need to make that decision sooner rather than later, and not be messing around for 3 hours and then decide to go to surgery. So surgery is a last ditch effort, right? We're going to have failure of medical treatment. If I come in and I evaluate a litter of puppies and heart rates are less than 150 beats per minute as an average for the entire litter, then that's an indication to go to surgery, and or an obstructive dystocia. If something's blocking the way, we can't get it out. And so time is of the essence. The faster we get those babies out with the minimal drug exposure, the better off we're going to be. And so I'm not here to teach you guys all of our anesthetic protocols, but what I try to teach my veterinary students is think about everything that you give to the mom. Whoever has to recover those puppies is going to have to deal with on the other end. So judicious, small doses, get away with as minimalistic as you can. And the faster you are, the better off you're going to be, because that means that those babies are under the influence of any gas inhalants for less time. And so we typically at our university have two separate teams. We have the surgical team, and then we have a puppy recovery team. And we have an almost nil puppy loss unless we knew something was dead going into surgery before. And that's because we have two separate teams, one for doing the surgery and one for recovering the puppies. We're not trying to do it at the same time. Whelping room, you guys all probably have things that are there. So again, the supplies that you gathered earlier, making sure that you've got a good, quiet, out of traffic areas and out of drafts with a peg rail, especially in those animals that are kind of a little bit more dumpy and don't know where their own feet are. We got to give those puppies a way to be able to get out of the way of mom, and making sure that we have those neonate recoveries. So there are 3 things that will kill a puppy faster than anything else: being cold, not having enough airflow or oxygen, and getting dehydrated. And so when they come out, okay, mom should be taking care of the stimulation part by pulling off the sac and eating the placenta, actually pulling on that umbilicus is a respiratory stimulant. She's licking them. That would be us rubbing them. And you can suction them if you need to. In our hospital, obviously, we've got babies that are under the influence of potential drugs because they're whatever mom was given, they got. We have oxygen flow by. The biggest thing is if any of you guys have Dopram in your possession, you need to throw it out. That drug is no longer recommended. It's actually contraindicated in recovery of neonates because it increases the intracranial oxygen demand. And for it to work, they have to be breathing anyway. So if they're not breathing, it doesn't do any good to give it. So again, no drugs. Making sure that you're rubbing them and rub them good. Okay. It's okay if they're kind of moving back and forth because mom's not super gentle with them. Keep them warm. The area that you're going to be whelping in, if you're not sweating, it's not warm enough. Okay. You should be sweating while you're working. And then suction, suction, suction. Make sure you get those airways clear. And then the biggest thing is checking for congenital abnormality. And so again, here's the cleft palate in a puppy, and learning that they have a cleft palate after you've worked on them for 45 minutes to wake up is kind of a devastating finding. And so while you're working on these things, making sure that you're looking and that you don't see any other congenital defects is really important. And I'll kind of go through. So one of the questions I had about reducing actual hernias. Hernias is a heritable condition. Sometimes it can be a one-off. But mom does not cause hernias. Hernias were there before mom even got a hold of them. And the way that we can prove that is how smoothly marginated hernias are versus traumatic hernias. And so here's a baby has what's called abdominoschisis. So that's actually GI tract that's outside of the body wall, but you can see how smooth the margination is of it. And when we get hernias, we have very smooth margination. And it's just failure of that body wall to close at the right time and at the right place. And this is not something that mom caused. Now, obviously, this is a very extreme case because we have intestines outside of the abdominal cavity. But that being said, mom pulling and tugging on that is not going to cause a hernia. That hernia was there previously. And if we're having multiple puppies in litter that are having hernias, we need to look back at our lineage and determine whether or not this is a genetic cause. Other things to watch for are at-risk neonates. So any puppy that is 10% or greater smaller than if the whole litter is this size and this one's about 10% or greater smaller than the rest of them, we need to be watching that one because there might be something wrong with that one, or that was the one that was at the tip of the horn, just may need a little extra care. But those are the ones that we usually send home with owners saying, keep an eye on that one. We wouldn't be surprised if they don't make it. So again, at-risk neonates, you need to identify those. And then premature babies. Premature babies, one of the last things that we see is hair formation on the muzzle, around the eyes, on the ears, and on toes. So these babies were probably 4 to 5 days premature. She whelped them. I use that term loosely. She aborted them because these babies slowly faded and died over the next 24 to 48 hours. So again, checking that we have full hairing on ears, muzzles, eyes, and feet, because if you have babies that don't have that or the whole litter is lacking that, then you need to be very, very careful with that litter and maybe seek help. Post-whelping, very important with neonates, daily weight gain. We're going to see problems with them not gaining or plateauing before we're going to actually see problems with them outwardly. So again, that first weight that you take is going to be very, very important. And then taking them every 12 to 24 hours after that, we typically will see kind of a plateau or a slight decrease in the first 24 hours, but they should take off like gangbusters afterwards if they're getting appropriate nutrition and thriving. Environmental control, like I said, being cold and getting dehydrated are the two biggest things other than hypoglycemia that are going to kill the baby. So making sure that you have a humidified room and that the temperature is appropriate. If mom is there and doing her job, then she'd be fine. This picture is from a nice working dog kennel where they actually embedded, they had heating pads, very specific type of heating pads that were embedded in the floor. So mom could go lay on something that was easily disinfectable, but not super hot. the baby so choose that they could go hang out with mom or they could go to where this was, and they did very well. And then dam nutrition and milk is really important. If you don't take care of the vessel, you're not going to take care of the cargo. I know the cargo has been delivered, but she's the one who's supposed to be feeding them. And so making sure that she's getting adequate nutrition so that she can lactate appropriately is going to be really, really important moving forward. And so the biggest take homes that I think that we need to talk about from here is planning, making sure that your bitches are actually in a good plan of nutrition and actually are used to working. Asking somebody to go and do a marathon when they have not been doing anything except for sitting on the couch and eating Cheetos all summer, that's really, really hard. And so if we have somebody who's used to doing brisk walks for 1 to 2 hours a day, and then we decide to breed them, that dog is going to fare much better than one that literally just sleeps on the couch all day long. Genetics is going to play into that, absolutely. Breed is going to play into that, absolutely. But the more that we can do prior to the breeding and during the pregnancy, the better off we're going to be during the whelping. And then being prepared. Have your vet on the same page, have contingency plans, make sure you're prepared for the worst so that when we have to switch gears and do something else that we're ready to do so. There are some references, and then I'm happy to take any other questions.
Amazing. That was so incredible. Thank you for walking through all that information for our community. I think people were really hooked on everything you were saying. And I imagine this is going to be super helpful for everybody. So the only question that I saw that I can answer is that this was recorded for anyone who missed me saying that at the beginning. So you can go back and watch this whole thing as soon as we end this live, because I'm sure there's a lot of really great information you shared that breeders are going to want to reference. You actually answered a lot of the previously submitted questions we got, so we just have a few left. So this first one is from Lori, who's wondering if there's any way you can tell prior to labor if a dam is lacking a Ferguson reflex.
So not prior to labor. Ferguson reflex in itself is something that is only a manifestation of stage 2 labor. And so when there's something up against that cervix or engaged in the birth canal, that produces the Ferguson's reflex. If they've already gone into stage 2 labor, we should be able to, we call it feathering the vaginal canal. Once we palpate up there, she should want to bear down and push on us, but that should only occur, and it's by invitation only. Please don't start you guys palpating your dogs during whelping. It's only in the event that we need to investigate what's going on. And that's the only time that's going to happen is in that stage 2.
Awesome. Okay, these next few questions are kind of, I think, a nice summary of everything that you covered in this presentation. So Francis is wondering, when labor is taking a very long time between puppies, is there a safe way to potentially speed up that process?
Yeah. And so again, I have my mentor in the back of my mind saying they don't call it labor for nothing. So they have to work. And so we need to make sure that we're getting any and all nutrition in them that we can. I don't want to force feed them per se, but if you can get them to drink milk replacer, Cara syrup and water, anything that's going to have a form of sugar source in it, it doesn't necessarily need to be yogurt. It doesn't need to be ice cream. I don't want to burst people's bubble, but I think the statistic is you would have to feed your dog like 4 or 5 quarts of yogurt to get the amount of calcium required to boost them for, if they were hypocalcemic. So again, I want it for the glucose source. When in doubt, get them up and take them for a brisk walk or trot. Sometimes that will actually kind of stimulate some uterine contractions. If you can just get them up, take them out to go to the bathroom, and make them kind of have not a stroll. I want them trotting and walking, and we will spend time sometimes running them up and down the hallways if we're doing medical management, just to kind of stimulate those uterine contractions after we've given some nutrition.
Awesome. And then another one of our breeders, Jan, is wondering about breech births and when you take over and how you can really safely help with those.
Yeah, and so I think it's just a terminology thing. So again, breech births don't happen that very, very often. I've seen one my entire career. That's when the actual spine is up against the cervix and it's in an obstructive dystocia. I think, Jane, probably what you're talking about are posterior births. And so those are normal. If they come tail first, 30% of the litter typically in the statistics that we have, and in my experience, 1 or 2 of them will come backwards, but they come out without any problem. Taking over, I think that's something that is kind of breeder dependent. If you have a female that is really freaked out by the process, I've had bitches the very first time that first baby hits the ground and they literally get up and run away from it. They go, they have no idea what that is. At that point, obviously open up the sack, start rubbing the baby, doing that because, you know, that mom obviously is not going to do her job. If she's turning around and attempting to do her job, let her try, because that oxytocin and mothering ability is something that we don't want to interrupt. And sometimes if we're not doing any justice by being overzealous. But again, most of the time I give them 1 to 2 minutes before I'll jump in there and start doing anything. The babies will be just fine, especially if you see them moving around in the sack. If they're not moving around, then you might jump in a little bit sooner. But again, that's just kind of a judgment call. I like to let nature take its course.
Awesome. Okay, I'm just quickly looking and seeing if we have anything else coming in live. But before we get to some of those, Donna's wondering how you can identify silent heats and if anything can be done for them. I know we talked about this just before we went live, but curious if you can give her an answer.
Yeah, and so again, silent heats are something that are a management problem. They're not a fertility problem, and hopefully something that I'll cover in my next talk. But most of the time when we have girls that are having silent heats, we have owners that are religiously going through every single day and wiping them with a Kleenex so that we can see if there's any color, because some girls are just really fastidiously clean. And or we're doing weekly vaginal cytologies or progesterones. And once we have their number, we know what they're doing. But silent heats, again, they're not an infertility problem. They're just a management problem.
Awesome. I think I'm looking at the chat. There are some questions that I think will be really great for future webinars. So I'm gonna take note of those and make sure we ask them a little later on in the summer. But our last question that I thought would be good to kind of tie a bow around all of this is from, let me see. Oh, Frankie, generally, is a dog that experiences a difficult labor likely to have a difficult labor in the future should they be
Ooh.
bred again?
That's a great question and probably something that I should have covered. So certainly the homage of once I had a C-section, always needs a C-section does not hold true. It doesn't hold true in humans either. It depends on what the reasoning is. And so I think this is where our history and being honest with the lineage of our dogs, if there are dams and or aunts behind this female that have had difficult births and truly were given every opportunity to whelp on their own, certainly we might have a different conversation than if it was just a one-off. So most of the time I want to give them every opportunity to do things naturally, and we as breeders should want them to do things naturally. We do not want to keep animals that can't get pregnant and can't whelp and can't take care of their babies in our kennels. That's not, we're going to end up with dairy cows, and we don't want those. Dairy cows drop their babies and walk away from them. They have no idea what they are. That being said, sometimes things go wrong. And so just because you had one thing go wrong does not necessarily mean in the future it's going to go wrong. But if we do the things nutritionally, exercise, and prepare, hopefully we're going to have a very good answer on whether or not this is the female or if there were circumstances that caused the dystocia.
Awesome. I feel like that was a really great question to end things on. So I don't think we have any more to go over, but thank you to our community for asking such wonderful questions. Thank you, Dr. Cecere, for joining us for another presentation. I'm already seeing feedback in the chat that this was the best webinar we've done so far. So that's really great to know.
Thanks. I appreciate it.
Amazing. Well, I want to thank everyone again for joining us today for another one of these webinars. These have been so fun to put together every single month, and we're glad to see that it's been so useful to everyone, especially today's topic. So if you're not yet a member of our community, please apply to join at gooddog.com/join and follow our Facebook page so you can stay up to date on all of our future webinars and events. And just to give everyone a little bit of a sneak preview, because we already have quite a few webinars planned for the rest of the year, we're going to be bringing Dr. Cecere back. And she will be joining us on Thursday, August 22nd at 1 p.m. Eastern. And the next webinar is going to be about putting the fertile back in infertility, another really catchy tagline. And we're going to be talking about the causes of infertility in brood females, as well as the importance of checking both the male and female prior to breeding. We're going to go over nutrition and fitness. So I think a lot of those questions I remember. So until then, thank you all again for being here for another webinar. Thank you, Dr. Cecere, and we'll see you back at the end of August. Bye, everyone. Thank you.
Bye. Thank you.